All right. Are both teams here actually? Yes, I believe so.
Yeah.
And by the way, I won't introduce you. They will introduce themselves, but I'll give some background actually on why we have them here, where they're coming from, and that just really quickly as well. So as you all are aware, I believe we made sure that we were happy to have you as participants in our 11 to Lab of Tomorrow process. And we're happy that we have especially you as representatives from companies and so on with a background in product development, NCDs and so on, which is a great basis for our process and will help really creating products that really work. We're happy as well, though, that some universities picked up our challenges and who have entrepreneurship programs and processes. When we picked those topics up, or our topic now here, NCDs for countries in Africa, it was Ghana and Kenya, for example, with the two universities that worked on those challenges. And yeah, we were happy that they picked those topics up as well, and that we had engaged and interested students that actually worked as well in the direction of solutions to the challenge of NCDs. They of course had a disadvantage that we could not provide them with counterparts in Ghana or Kenya to work as user-centered as you can, but they as well were able to connect with people in Ghana, for example, and others. So they got a good grasp of the challenge at hand. Yeah, we took the chance, or want to take the chance here to have them, two of the teams of those two universities, I think overall it was like 8 teams, to present their solutions, what they came up with. And this can be an inspiration for you, inspiration, direction of ideas for solutions. And as well as we have the prototyping sessions tomorrow to see how they actually, what kind of prototype they created, and to give you an input on your next step. Also, next to the inspiration, maybe you should keep those teams in mind. As I mentioned, they are engaged students now I've made contact with the topic, and might bring helpful contributions in the future to you and your teams. As soon as you are in the incubation phase or further, maybe you need more capacities, more competencies, and then we can always get you in touch with those teams to add resources and interested people. And that was my introduction of the background. And I guess then, Gordon, I'll hand over to you to hand over to one of the teams.
Right. Okay, so Sophie, which team should go first?
Yeah, we can start with the team of MedQ, and the one who is presenting today will be Maximilian Müller. So a warm welcome to Maximilian Müller and his team.
A warm welcome to Maximilian.
Hi, thank you. In the name of the whole team, thank you for having us today. And yeah, we're already excited to present you our ideas. And just a second. All right, I just start. So yeah, thank you, as I said, for having us today. And we, the team of MedQ, would like to present you our idea today. And first of all, I want to give you an initial quote that we received from Martin Gameli, who's an IT professional in the health sector in Ghana. And he told us that people go to the hospital very randomly and wait for hours to see a doctor. And that was our baseline that we worked with. And yeah, today we present you MedQ, digital services for your hospital. So first of all, we came up with personas, so it's easier for you to have an image of the problems we're facing. So on the one hand, we have Akua, who's a patient or a potential patient, and she has breast cancer in stadium 3 already and perceives a mild pain in her breast region. She has a public insurance, but she does not have the time to see a doctor. On the other hand, we have Kwame. I hope I pronounced the names correctly. On the other hand, we have Kwame. I think he's born on a Saturday. And he's nurse in a peak capacity hospital works extra hours on a daily basis, and additionally he has to manage some operational tasks as well. So having these personas in mind, we come to the problem we're facing. So on the patient side, yeah, we found out that diseases are often just detected too late. So, and some other observations we made were that especially medical care happens only in primarily in public hospitals. So seeing a doctor usually happens without an appointment. That's what we had from the initial quote. And yeah, this leads to crowded waiting halls during the COVID-19 pandemic, which is obviously not a good thing. And ultimately, we have long waiting hours and non-transparent organization of the tasks in the hospitals that are not clear to the patient at all times. On the other hand, we have the problems for the hospitals. And yeah, our main observation here was that the digital potential still remains unused. And this is mainly due to hospitals almost solely using analog queuing systems and rarely even having an appointment system at all, or an appointment system that is digitized. And yeah, basically we're missing data acquisitions here that could be used for HR task optimizations, for example. And subsequently, this leads to uncontrolled streams of patients popping up in the hospital, and yeah, it's really hard to forecast these streams at all. So this is why we came up with our solution, which is a virtual queuing system. As you can see here, what we're trying to do is to reduce the presence waiting time, so the time a patient in average spends in the hospital. This can be done by the patient, writing or texting to our chatbot that we want to set up. And so he can queue up already virtually, like let's say an hour before his actual appointment or even less. So our service basically optimizes the process of waiting and maybe could even steer streams of customers, sorry, not customers, they're patients. Well, here you can see our process modeling. Yeah, the regular case would be here in orange, where the potential patient comes into the hospital, checks in presence, and then waits in the waiting room or the waiting hall for, let's say, 1 hour 30 until he receives medical care. And a lot of this time could be skipped by our virtual queue here in green, where the patient already checks in from wherever he is or she is at the moment. And this could lead to significant time savings, actually. And here on the bottom, you see triage cases. They would at any time be prioritized over virtual queues, obviously. Yeah, this is the prototype we came up. So we want to use WhatsApp as the basis for the chatbot, basically because it is the most used messaging app in Ghana, or this is what we found out. And simply by texting this number, you would receive any further information on the procedure of checking in and receiving your medical care. But later you see a bit more of that. Well, the benefits summed up here is that we want to reduce, on the patient side, we want to reduce the barriers to see a doctor. And this we do by reducing the waiting time, increasing spaces between patients due to not so many patients being in the hospital at the same time. And as the patient can always track when it's his or her time for the appointment. So this leads to transparency, and ultimately, because we speed up the process and yeah, get people in the hospitals, we would then have better medical care for the patients. On the side of the hospital, the benefits resulting there would be mainly data-driven analysis. First of all, we have data acquisition which could be used for example, visualizing patient streams that then could be used once more as, or for having peak management, or for example, forecasting HR demand and having an on-demand, maybe even an on-demand HR planning. Well, this is the screen, or it's a screenshot of the website we come up with. Currently it's offline, but this is due to registration. And as you can see here, we want to work with QR codes. The QR code is the code, or is a code that you would use on your phone and then show in a terminal or show to the reception staff in the hospital, just for speeding up the process. And this basically links the back end of the hospital to the front end of the customer. Yeah, here's some more insight from the website. So basically any information on the tool could be provided here based on FAQs and any other information that we would like to display here. And here once more, you can see the prototype we came up with. So here once more, you can see the QR code that is given to the patient after going through the whole process. And the process is basically just putting in numbers, and also the number here in blue on the left-hand side would be, for example, a possibility at least to put in the membership number of insurance. So there's already potential for a digitized health file, for example. Yeah, and this is our vision. We want to build trust by digitizing the health system, and this is our team. And with that, we want to thank you for your attention. And yeah, if you have any questions, please feel free to ask.
All right. Thank you so much, Maximilian. Let's take questions. Who's going first? There's a hand up that I cannot see. Oh, Sylvester.
Yeah, thank you, Max. Can I call you Max?
Yeah, sure.
All right, nice one. Great team. You're doing really, really well. I think taking the easily accessible tools and then merging it to form a different tool altogether to deliver a service, to offer value is good. I really impressed, and I really appreciate what you guys are doing. I have some questions though for the stack behind what you're doing. At the moment, maybe I don't know much about WhatsApp, but I think WhatsApp doesn't really allow much of integrations from the B2B side. Do they have that kind of service? You know, or if they don't, do you have a different stack behind? Do you have a different AI stack behind WhatsApp that will actually receive the messages? And how are you handling that aspect? I'm keen on that side.
Yeah, I think I can answer that quite easily. I think there is a provider that we checked out that does all the process. So there's already a tool existing that we do not have to program, because none of us has any IT knowledge, so to say, or coding experience. So, but there is tools already around that could be used for that. But if that's too heavy, we didn't check. Actually, you could basically just switch to a text or a short message service-based solution as well. That should not be the problem. But when we checked, at least, we checked for a provider of this chatbot version. So we would not come up with our own solution here.
Okay. All right, sure. Yeah, one more thing.
Yeah.
Are you open to sharing tools and resources? Because we are working on something similar. Some of our solutions that we are working on might need some of such resources. So if you don't mind sharing with us, I think we really appreciate some of those stack behind that, the bots, the chatbots, like you said, they're tools that if you are able to share with us, we really appreciate.
Yeah, I guess we can do that actually, because we would like, I mean, we at the moment we are all lacking time and own resources to actually develop this prototype further. But we would be glad if it actually lives after our project. So yeah, we would be glad to.
And I'm always around.
Change afterwards.
If you guys need some extra hands, I'm always willing to train some help. If you willing to have me help in any form anyway, I'm all in.
Cool. Yeah, that sounds great.
Great. I also have a question regarding whether you've tested the prototype. You said that you have a WordPress site, was my understanding, and that you have potentially the WhatsApp bot, or probably in the first instance a dummy. How did you test so far, or did you test at all?
Maybe some of the other guys can jump in because I wasn't involved in the prototyping, but I think it's just like the surface was designed by us, but like the chatbot behind, we didn't yet really test, but maybe someone else from the group can answer the question accordingly.
Maybe specific, to be more specific here, I'm talking about user testing as well. And what you use.
I could jump in. I know we tested, or we looked up the information that we would have a chatbot if we develop the idea. There are options and solutions to use or to buy the chatbot, but we didn't actually test with this solution. We checked with our own phones, or like changed our number to the chatbot, made it manually for the prototyping, but we have checked that there will be an end solution if the idea lives on. But we actually did like manual prototyping.
Okay. Great. And did you do actual user testing?
We didn't do the user testing with the chatbot, no.
Okay. Did you do any other user testing? And if you didn't, that's also fine. I'm just curious, you know.
Torben, you want to jump in, I think.
So no, we haven't done any user testing. We talked to the experts and like feedbacked our ideas, and mainly focused on the idea itself. But we haven't done user testing. So same goes to the WordPress side. We used a plugin or a system where we managed to like make an appointment with the website, but we just tested ourselves. So I think it should be working, and we figured out how to do it, but we haven't. We didn't talk to a hospital going the next step and actually testing it on site.
Okay, great. Thanks. Thanks.
Any other questions? I have one about, I think, Max, you did mention that what you lack now is time to do development. So just want to probe a little bit on that. We have companies here, and we have people who work in the industry who are working on similar ideas, as Sylvester said. So what will be your ideal situation or ideal outcome out of this experience right here, presenting your idea?
Yeah, that's a really good question. I don't know. Like I said, we would love we would love to see if it lives on like the prototype. But to be honest, it was a university project primarily, and now we didn't do anything further. We waited for this appointment, but we're pretty much open to anything regarding further development and so on. But we do not really have an ideal solution in mind yet, but this could be discussed easily, I guess. Or does anyone else from the team has any thoughts on that?
Okay.
I'd say the same as Max did. We'd be open to discuss the idea and to take it a step further if the interest is there from your side. And yeah, we'd love to like grow the enterprise, or like as a social enterprise. It was the idea that it would be a social enterprise, and if it helps people, why not grow it further?
And for sure, we need on the development side, we need a lot of help. So all of us as business students, and that's something we like totally. So if that's like something we can come together, I see a future. We work together to get it done. Also, we looked into the financials. There aren't too many investments needed to get like one hospital started and to figure out whether or not it's working really. But what we really lack is the programming side.
What you said is you're mostly business
this
students, so the design part. Yeah, Max?
Yeah, one more thing is also, or that just came up to my mind, or what we didn't really think through yet, is regarding data privacy issues. Like especially having WhatsApp as a solution, maybe there's a huge pile of issues coming up that we did not yet think through at all. So this is also a thing that, if the prototype would be further developed, has to be considered thoroughly, I guess. So but yeah, I think this solution, or the solution we develop, actually is not only feasible for the health system, but also for any kind of system where queues are being used. So basically there's a lot of potential behind, even for other cases. So if there's room, or if there's more resources, that there's, I think, a huge potential, like I said already. Yeah.
Okay. All right. So I think without any other questions, we would like to thank you very much.
Thank you.
Wonderful. Thank you so much.
Excuse me.
Somebody will say something. Yes. Yes, Sylvester.
All right. Forgive me if perhaps it was addressed, but then I didn't really catch it. But did you make any comments on the value, that's the business model aspect, how the different stakeholders are going to make some money out of it? Because at the end of the day, there's always a driving force that fuels sustainability. Forgive me. So without that driving force, everything just tends to die off along the line. So the agents involved, how you intend to connect them, because the patient is mobile. They are not always stuck to one hospital at any point in time for the rest of their life. So they keep moving on. So at the end of the day, if they are not getting the same value that they used to get, that patient becomes a customer lost, and then that business also becomes a business that is lost. And then it means that the entire model tends to die off over the short term, instead of living for forever. So did you really factor into it the business model aspect, and how you intend to address that, making sure that you as a business, be it an NGO or charity or social enterprise or full business, whatever model you take, you are making your share, at the same time to providing value to those in the value chain, making sure they are getting their cut, and then the value is still being produced. How did you address that?
To be honest, we only scratches all these topics on the surface, because like for the university part, it was not like the focus. The focus was on the idea, but the case we actually built up was a case where it's more or less, let's say, amortizing itself after a few years. But I think what we thought through was an initial investment of approximately, I think it was 200,000 euros that would be needed. But as we already said, we're not so deep in this IT things. There's probably a lot of things we didn't even thought of. So yeah, but I think, or that's at least just my opinion, not from the whole team, I think it's scalable. And if somebody would want to make money off this tool, it would be possible.
Okay. Well, thank you very much. I'm also looking at the time here. So we've done 30 minutes. So thank you very much. All right. So, okay.
Yeah. I'm leaving
Very
my
wonderful.
LinkedIn address in there, so in the chat. So if anyone wants to connect, I'm in the chat.
Perfect.
All right. So let's go to our next team.
I will jump in, and that will be so social. All Gregor Hofmeister and Daniela Reiter will present that idea. And sorry for the pronunciation of your project. I'm sure you will do it way better than me.
Quite simple. It's so social.
Okay.
So I'll share my screen real quick. 1 second. All right.
So yeah, a warm welcome to everyone from Daniela and myself. In the following few minutes, we are going to give you our perception on how to create awareness and education regarding NCDs and their underlying risk factors in Ghana. So first off, yeah, we start off the current situation and the main problem, and then our solution approach, the underlying concept and process. So starting off with an extract from the Non Communicable Disease Progress Monitor from the World Health Organization, published last year, it can be seen that Ghana has neither achieved a national integrated NCD strategy, operational or action plan, nor sufficient action regarding unhealthy diet reduction measures, as well as not initiated a public awareness campaign on physical activity. So to sum it up, according to the World Health Organization, there is room to improve and room to initiate. So in particular, overweight and obesity are a rapidly emerging problem in Ghana's more prosperous society. In the capital region of Accra, almost half of the population is affected by overweight or obesity. So unhealthy diet and the lack of physical activity are the key factors driving this development. And these high figures should be indeed questioned. And frequently there is an insufficient knowledge about one's own lifestyle and potentially severe effects of incorrect behavior patterns. So the main problem from our perception for a certain number of Ghanaians is the lack of awareness as described. So starting from an unhealthy lifestyle, so lack of balanced diet and a lack of healthy meals and physical activity, which can lead to overweight and obesity, which then in turn increase the risks of, in particular, 2 NCDs, diabetes type 2, and certain cardiovascular diseases. So our solution approach to counteract the problems mentioned is, and what it aims to cover in particular, are the following 6 aspects. So in our project at the university, we had the task, as I said, to increase awareness and education for the NCDs and their underlying risk factors. And since most cancer and respiratory diseases are hardly influenced by 1 or 2 risk factors, we focused on the ones of NCDs which have a major responsibility. We focus on the 1 risk factors which have the major responsibility for causing diabetes type 2 and cardiovascular diseases. And that, as I said, would be one's own lifestyle of eating and the lack of physical activity, which then, as I said, turn to overweight. So we intend to combine aspects of a social cooking event where we raise awareness about certain behavior patterns to counteract suffering from NCD in a preventive state. So therefore, we came up with the idea of So Social.
So Social is offering cooking events that recreate the traditional Ghanaian way of eating with new and modern approaches. Under the slogan, enjoying the power of healthy meals together, we want to create a broad offer to interact with each other, to learn and to implement new recipes, as well as to raise awareness about various diseases in a kind of playful way. Through this, we raise awareness for a healthy lifestyle and the understanding of the connection between one's own diet, risk factors, and NCDs. The mainstay of our business are healthy group cooking events of all kinds. Whether for friends, families, or singles, there's something for everyone on our platform. Together with an expert chef who is specialized in healthy nutrition, participants learn about healthy recipes and actively prepare them together. In addition to offering alternatives to otherwise very fat or calorie-rich dishes, our event features recipes that focus on nutrition and wholesome food. But how to book our event? It's very easy, through our website. We select the button Booking in our menu, and you will then lead to the next page where you can choose between different event options. Then on the next page, there's the possibility for you to choose a date. And then in the next step, you choose between the venues either at home or the So Social kitchen. You will then be taken to the next page where you can choose between one of our friendly chefs, which are briefly introduced there. After that, you indicate whether you are a host and enter your name and email address. And you can also then leave a comment in case someone has any special needs. So finally, you can choose your preferred payment method, and people will then receive a confirmation email with all the important information afterwards, and they can forward it to their family and friends who would like to participate. There's also supposed to be a So Social app that has the exact same features as the website. Yeah, so you see, So Social is a comprehensive concept around healthy eating and offers useful information in addition to the fun of socializing.
Right, wonderful. All right, let's get some questions in. With another team, where's my healthy lifestyle people? I think I saw Doris here a moment ago.
Hello.
There she is. Hi, Doris.
Hello.
There you are.
Hi.
Any questions for the team?
I happen to be driving. Yes, I do have a question. And my question is, I realize that you need to place an order in order to access their services. And they also have about 3 chefs that help with orders that come in. What are their plans to scale? And so when it comes to scaling, how are they? If they have a lot of orders coming in at a point in time, how are you going to meet them given the number of chefs that you started with? And your chefs, do they have to pass a certain selection criteria? Thank you.
Yeah, we heard that there is a cooking school around Accra, and we thought then it might be a good idea to recruit some of the
quite younger chefs, so to get like a synergy effect from marketing for like their own, and on the other hand, educating in like a cooking event as a professional chef. So that's like the one, that's what we thought about could work to when we thought about how to get chefs, how to get enough chefs if we want to scale our concept.
A quick
what about
follow-up.
the system? Yeah, okay, go ahead. Go ahead with a follow-up.
My follow-up question is, I want you to give me your take on this. Is your app supposed to also provide the option for chefs across the country to list so that you can bring chefs in contact with consumers who are mindful of the quality of their meals? I hope that is clear. Instead of 3 chefs, would you consider an option that allows many more chefs to just list on your app because you have screened them, and then customers can just subscribe so that they can book your chefs?
Yeah, of course, absolutely. It was just an initial idea to start with 3 because we hadn't any idea how much it would be wanted by the potential customers, and so we thought 3 chefs might be a good base to start.
Pricing. What are your charges? What's does the potential customer pay? Do you charge by the hour, or do you charge by the variety of recipes that are cooked at a time?
Mm-hmm. Our initial idea was to charge a fee per participant. So, for example, $8 per participant. So we thought this might be a good start. So we started to think, okay, how much does one person eat? And then we tried to sum it up, and we started with $8.
Thank you very much.
So the $8 we wanted to do a little benchmark, and in the internet when we Googled, it said like a normal cinema ticket costs around $4 to $5, and that's how we came up. Since we are offering like a social event, we thought that the $2 or $3 more than like a cinema ticket would be considerable and reasonable.
Right.
If I should give you feedback on your pricing, it's not bad, it's reasonable, but it's also not that affordable, given that we have citizens that live on about $1 a day. Thank you.
Thank you.
Yeah.
Thanks.
The issue of multiple economies in the same country. Other questions? Any other questions from the lifestyle group?
Hello, it's me again. Yeah. So if you don't mind laying a bit more emphasis on your rollout, and then are you going strictly virtual, or you intend to have some stationed some resources to create stationed venues? And if that's the case, how do you intend to sustain it? Because when you are discussing station venues and then food and then people accessing that, it means that they must go and then come back. So you are looking at repeat customers, and how do you intend to actually identify a space that won't compete with, already dominating industry players, say restaurants or hotels in that cycle? Because it means that you are putting more overheads on your overheads in that regard. If you're going virtual, how do you also sustain that? And if you're also going physical, it means that your reach is now limited, and you are, whatever budget you have, you are now going to spend more in marketing and then staff management. It means you are spending more compared to how much you're even getting. And then, like my learned colleague mentioned, in terms of pricing, it sounds good, all right, but if you're targeting the masses, quote unquote masses, where you want numbers to really work for you, then it means your price is kind of high. So how do you intend to actually work around that, those margins, those numbers, to make sure you're operating at a break even? And then at what point in time do you expect to see a rise in your revenue curves, to make this sustainable? So question is it physical based, virtual based? Is the website apps helping you maintain a physical presence model, or you're going all virtual model? And in either case, how do you make it sustainable to make sure that the business doesn't die off after 2 years or 3 years, if not the first year?
So we thought the initial idea was that if they do the cooking event at home, that the host doesn't have to pay to participate at the cooking event. So we are allowed to use the location, and the host doesn't have to pay for it. So that maybe people would think, oh, nice, it would be nice to have it at home and I don't have to pay for it. And then it was an idea that after the event, everybody who participated will get a follow-up email where it is described what we cooked and how we did it. And there might be also some addition, like maybe a discount or something special that might convince them to do it another time. So we kind of want to create a chain effect.
Okay, I think that answers part of the question. So it means that you are going physical, but then you want to actually use the locals to actually get that running. So then my concern, you see, there's this thing with the Ghanaian environment, yeah. And let's just hit the nail on the head. When something comes up new, yeah, everyone hypes it, everyone embraces it because they want to try it. But your real model lies in the repeat customers. Are they going to come back after they try it, or just going to just rise up and just goes down? And how do you intend to convince the locals to take this up and then own it?
That's a very good question. So as we presented, we want to do a special events also. So not only cooking event, but then maybe I can show the. So so we want to start with a basic event, which would be friends and families, and then we want to try to evolve it. For example, so socialize would be that different person can just register that they want to participate in an event, and then there would be I don't know, 4, 5, 6 strangers who can be put together, and you can make new connections, new relationships. Or for example, a quiz night where everything is combined with quizzes around entertaining or interesting facts. So, and this is only a starting idea, but maybe we can just evolve it even more and then have several different events which could be booked.
Okay, it sounds interesting, but I'm more in it's. I'm sure not to take so much of all of our time. I'm sure we can look into it more later because there's always a catch. And then if anyone hears this concept, the question they're asking is, so what's the catch? Are they coming to the event to pay to attend the event? And then are they also going to pay you to go and host their own event? So like how does that chain thing take place? So people are more into that. And believe me, when it comes to cooking, people love to eat, to enjoy, but they don't want to put in the work, So to have it move by itself, I'm sure you look more into that, but we are always around to offer our suggestions, to make whatever helps the community. We are all in for it. So yeah.
Yeah.
Can I give some feedback?
Yeah, of course.
Yes, great. I really like your prototype. It's an easy way to really illustrate the idea. It comes across very good. Thanks for that.
Thanks for feedback.
And that's an important feedback because that's one of the things we want the teams in our program to connect to, the way you prototype, so they can see what they can learn from it as well. Okay. Any other questions? From our teams, any questions about the prototypes? And whilst people on maybe 1 or 2 people are still thinking of unmuting, maybe I can ask you guys, Daniela or Greg, how would you prototype, very, very briefly, how would you prototype your idea? will you just show people the screen and ask them on a scale of 1 to 9, to what extent would you, or how much would you pay? How would you do it?
To be fair, as a part of our university project, it was like focused on the concept and not on like the prototype. So we thought about what is like quite creative as a prototype, as a probable website, as a website or an app, to test. Perhaps Daniela got any ideas?
Honestly,
Right.
we thought the website would be the most effective way to show our way of thinking, how we would want to create the idea. Of course, in our presentation at university, we also described in detail how we wanted an evening to
take place and how it's structured and stuff. So to give a quick answer, we don't know how to test the website and how to get like feedback that improves it
Okay.
quite effectively.
Okay. All right. So we are at time. So there are no more questions. I want to say a big thank you to you guys as well. Thank you. Any comments from maybe Jonas or Eric or Sophie?
I just saw one question from Selassie. He was asking what were the tools that the two teams used for prototyping.
Yeah, except that they said they didn't prototype.
Yeah, but we saw prototypes in the presentation.
Oh, you mean that in the creation of the?
Yeah.
You mean the creation of the prototype? Yeah.
Yeah. So am I right that I assume you use PowerPoint, just plain and simple?
No, I honestly used Procreate. That's like, usually it's a drawing app, but I just tried to build a website with it.
Okay, cool.
Yeah.
And I think Max said that he used Canvas, and they have.
Yeah, we used Canvas for the design part, for the slides, and I think that was the main tool we used, and also some like PowerPoint templates for like business model canvassing, but just basic tools you use for that we had from the chair to address innovative topics. Yeah.
Okay. All right.
Nice. Thanks.
Eric, anything? You had a nice opening, so I was wondering if you had a nice
thank
talk.
you. Thank you very much.
All right. Thank you, everybody. That was wonderful, very inspiring. You guys did this as a student project, so it puts great pressure for our teams because now they have to do better, right? You know, so that's great. Thank you so much for the inspiration. Thanks for coming as well.
For having
us. And yeah, goodbye to everybody. And
please link up. Let's do more. I'm very interested.
Link up with Sylvester in LinkedIn down there. All right. Link in with Sylvester on LinkedIn. All right. To our people, we'll see you tomorrow.